Well, I'm super excited here on our second vlog podcast with the Dr. Mike Show, talking all things pulmonary and critical care related. Hoping to get more information out to our patients about important aspects of pulmonary medicine. And really the design of our show is to talk to people with compelling stories. I'm super excited today to have with us an unbelievable, compelling story, an individual who is not just a patient advocate, but a patient himself, and a person that has a story that needs to be told more to help both our patients and education of some disease processes, which we're going to talk about today. And furthermore, I've been doing specifically pulmonary medicine for a really long time, and I have a passion for a specific type of condition called alpha-1 antitrypsin deficiency, alpha-1 disease. It's a lung problem, a condition that impacts people's lives, makes it harder for them to breathe, and can be devastating at times. I do a lot of advocacy and going around talking to practices and doctors to educate them about that condition. About 8 years ago, when I was here in Chattanooga, I had the opportunity to go down and talk to a small town just outside of Atlanta. Part of that opening series of lectures, there was an individual named Len Geiger who gave an opening conversation telling a story. And I sat in the back of this meeting, didn't know who this individual was at the time, and I was in awe. The story was unbelievable. The survivorship and what you bring to the community and how you got there is incredible. And after your conversation, I was like, well, this is an individual I got to get to know, and this is a true hero. Of course, then I was asked to come up and speak after that, and I said, boy, that's a hard act to follow. So we welcome today a gentleman named Len Geiger, who not only had the condition of alpha-1 antitrypsin deficiency, and he's going to tell that story, but also is a double lung transplant recipient and required a new set of lungs to help him get through this. So welcome, Len. And
it's a pleasure to be here.
You tell your story of how you got to the point where you were realizing you had a lung problem condition.
Yes.
And you mentioned something where you had a phone call and you were told you have 15% lung function. What did that mean to you, or how'd you learn about it? And what do you tell other patients who are told they have something wrong with their lungs?
Jeez. That original phone conversation was actually about my diagnosis of alpha-1 prior to finding out what my lung function was. And that was a bit of a devastating conversation because it involved so many different things.
Right.
That I've got this disorder, that I'll be getting an IV on a weekly basis for the rest of my life.
What year was this about?
This is 1994.
How old were you?
I was 35.
35.
Which makes me, what, 42 now?
Absolutely.
Something like that?
And I just turned 43.
Hey.
But leading up to that, you were an active young individual.
Yes.
What were the symptoms you were experiencing? Like what made you realize that I need to go see a doctor?
Yeah, the primary things that were happening to me were chronic chest infections. Mm-hmm. Every winter, I'd get that really deep chest infection. I think a lot of people are familiar with that really deep bronchitis.
I got bronchitis.
But every few years, you get a really bad case of it. And I started off that way, and then every year that went by, I was getting it more and more frequently and a little more seriously. And
were you having wheezing?
I was wheezing, and I always declined to call it shortness of breath because that sounded like something really horrible.
Right.
So I just said I had tightness in my chest.
Right.
And
I hear that a lot.
I was having breathing issues.
Right.
But I kept on going to urgent care centers.
But you didn't know any better. You're minimizing your symptoms, but everyone's telling you you're just out of shape or something maybe.
Well, yeah, I'm a little bit older. I'm in my 30s. Whew. And have gotten out of shape, maybe put on a few pounds, not as active as I used to be. So of course I'm having issues like that. And I think I was having some denial going on at
Right.
the same time, where I didn't want to
What
have
did
to
you
deal
do
with
to
it.
try to compensate? Didn't you try to, I'm going to exercise more?
Well, not until later I did
Okay.
that. There was but for a long time, my compensating was doing what everybody does when they want to compensate because they can't breathe.
Right.
They stop walking upstairs. They walk more slowly. They come up with excuses.
And at some point, didn't someone just tell you, "Oh, you just have asthma"?
Okay, so this was my first chance to actually go see a real primary care physician.
Right.
I had been going to urgent care centers where they would treat the acute exacerbation that I was having,
Right.
but it
But
was
not go much farther than
not
just
no deeper than that.
you know,
No deeper than that.
a
And
15-minute visit. Here's an inhaler, an antibiotic.
antibiotic and expectorant, and
Right.
get some rest. Drink a lot of fluids. You're going to be fine. And I was.
And you got a little bit better.
And then I get sick again.
Did you ever talk to your family at
No.
any point to say, did mom, dad, any of you guys ever have breathing problems?
No, I did the opposite. I hid it from everybody.
You hid it from it.
Yeah, not just from myself, but from everybody. And that it was actually it was my 35th birthday that my parents had invited me out for a nice dinner. I was married at the time. It was me and my wife and my sister, and we went out to eat dinner and celebrate my 35th birthday. And when it was over, I was planning on walking my parents to their car, and I couldn't because I was leaning on a stranger's car right outside of the restaurant door, trying to catch my breath because
And just for everyone out there, that's not normal.
This is not normal. This is not normal at all. I because of the feeling in my stomach, from my understanding, is my diaphragm didn't really have anywhere to go, so I couldn't put any more air into my lungs, and not being able to walk across a parking lot and having my entire family staring at me.
Seeing that.
That was the big turning point for me, where I went to go seek help.
And who was the first person you went and sought help for?
I went to go see my physician with Kaiser Permanente in Georgia, Dr. Michelle Huggins. She was the one who had 2 years prior to that had actually diagnosed me with exercise-induced asthma,
Right.
which I'd been taking albuterol for,
Right.
and using lots and lots and lots of it,
And
and not
noticing
getting any better.
no improvement.
No, really, really not. I went back to see her the very next day and told her that this doesn't seem like asthma to me. I said, would you please test me for everything you can think of? And
Right.
she had been to a conference recently
Yes.
where she had heard about this rare genetic thing that can cause bad
Similar
lung
to what we
disease.
opened up with, like a patient advocacy or
Yes,
a CME
something
conference,
like that.
something like that. And a little jewel of nugget of knowledge was put in her
Right.
brain.
So she did all the normal things, the things that she should do right up front, the EKG, ordered a chest x-ray, ordered a spirometry,
Right.
and then drew some blood to send it off to the lab just to
Yes.
rule out this rare thing.
Right, this
'Cause
rare thing that's
you couldn't possibly have
that's
it. But
new. That
yeah.
I heard about it in a conference. It's so rare.
I've never
unlikely
tested
you have
anybody
it.
before. Why in the world?
You're the
it's-
first person she ever tested.
Yes, to the best of my knowledge. I mean,
Right.
I should phrase it that way. And 2 weeks later, got the telephone call, and that was the call.
That was the call.
Yes,
So you already knew you had bad lung function.
I did not even know. We had never done any pulmonary function
Okay.
testing until that phone call, and that was when I went to the pulmonary lab, and that's when I found out that I was going to be in.
Tell me a little bit about the phone call. What
Oh,
was
oh.
So she tells you over the phone
Yes,
this rare test that she didn't think you were going to be positive for
yes,
comes back bad news.
yes.
How did you digest that? What were the thoughts initially, and then what was your response the next day? You said, okay, what am I going to do?
Well, it was actually kind of an interesting conversation because you got to remember it was 1994. So she didn't call me and say, "This is what you've got. You should look it up on the internet,"
Right.
because there was no Google or Yahoo
Right.
or anything like that, and she certainly couldn't send a link to my iPhone. So again, there was no iPhone,
Right.
and so she's reading text to me out of a book, and it's all going right over the top of my head, and I really didn't catch what she was saying. It took a while for me to comprehend the depth of the nature of the telephone
Right.
call. But then she starts telling me, here you need to write down all these telephone numbers, and it involved intravenous treatment and pulmonary function testing and a referral to a pulmonologist who's going to be taking care of me, and at some point is going to send me to a center to be evaluated for a lung transplant.
Right.
This was a heck of a conversation.
Yeah, one call over the phone, not even face to face at this point.
Well, she was in a rush to get the information to
Right,
me,
of
and she
course.
did stop herself and actually said, "Hold on, do you need to come in so we can talk about this?"
But we do the same thing. I mean, sometimes the test results are so important.
Yeah.
Patients have some anxiety, or they want to know right away, and we try to give them information as soon as I get the results by phone, with the expectation that I'm going to see you tomorrow. So we're going to talk more about it. I just want to get you the initial
and we
results.
did later. We did later, but it was very difficult trying to absorb all that information and in my mind trying to remember what she had said, and knowing that I don't understand this, but I'm a smart guy. I'll figure it out.
What kind of work were you doing?
I was in medical sales.
You were?
Yeah.
Selling
strangely
what?
enough. I think at that point I was in the reference laboratory business.
Okay.
I had
So you knew familiar with lab work and lab tests.
Yeah. I knew what an alpha 1 test cost,
Oh,
and I
that's
knew who I
wild.
sold it to. I just didn't know what it was for.
That's crazy. That part I never knew.
Well, there were 10,000 other tests I sold, so it was
right. That's cool. So then, going forward, there you, what happened next? Like, where did you go after this, and then when did you realize you have this is not just a conversation about, hey, I have a diagnosis, but I have a serious issue that I need to start evaluating more, considering more carefully where to get treatment and what kind of help did you seek? Because a lot of my patients or patients out there, very similar story, but they don't know who to turn to next beyond getting maybe a referral from their PCP. Like
Well, this because it was an HMO, and they planned everything for me.
Okay.
And had everything all set up for my IVs and for all the treatment that they, that I was
But at
going
this
to
point,
need
it's a
immediately
fairly
at that
novel
time.
treatment, and no one's really experienced enough with it. But they already had that in their network.
Their database was
That's
pretty
great.
up to date,
That's great.
and
Very lucky.
I know I was extremely lucky, ridiculously lucky. I mean, number one, to have been diagnosed that quickly once we realized how bad this was, but also to have to be with an organization that knew how to take care of and knew how to regroup and wrap themselves around me to some degree.
And we like to say, you say diagnosed quickly. Although you were probably having symptoms from the age 30 to 35.
Or maybe even late 20s.
Late 20s. So it's really like a good 5 to 8 years before you got a diagnosis. Yes. And we talk about how it's often that's a very standard pattern we see in the office of a referral, someone who has breathing issues. And sometimes it takes 2 or 3 physicians before someone raises the red flag and does this special test, which is a simple test to do. And sometimes it's 5 to 8 years later before that diagnosis is made.
And he's lost a lot of lung function over that period of time.
And like I tell our patients, and you know how important this is, lung function is the name of the game. Our job is to preserve lung function. And you know already now at this point that you had 15% lung function.
At that point I had mid-30s.
Mid-30s.
Yes, percent, which is still horrible.
Horrible. Anything
Just
below
really,
50% is really,
it's
worrisome. Below 30, we tend to say, hey, you're going to be a respiratory cripple.
Yeah.
And now you're progressing in a way that you're declining rapidly.
Yes. And so the therapy did slow it down.
How long were you on therapy before we kind of get to this point where you start in therapy, and then how many years between that when you now someone approaches you and say, hey, we need to think about a lung transplant?
It was actually only about 3 years.
3 years
before we decided it was time to start really looking at it. I had a very, very serious exacerbation right about 3 years out, a little bit less, and we're talking. I was bedbound for several weeks.
Right.
It took forever to
high dose
recover
steroids
from that. Very high dose prednisone.
And I mentioned that because that's going to be an
leads
important
into something
part
else.
Of the story.
Yes.
That's a teaser, everyone, so that we'll get to why that is critical. And then the other thing is exacerbations for physicians and for patients is super important to treat aggressively, because every exacerbation you lose a little lung function and you never get it back to the same level you were at before the acute event. So we really want to be aggressive at treating those exacerbations early with high-dose steroids and antibiotics in the effort to preserve lung function.
Yes. So one of the more interesting things that happened to me pretty early on was when I was told what the medication was that I was going to go on. And of course, there's, again, no internet for me to go on and try and find out about this. Went to a drugstore and had them print out the package insert for that medication.
No kidding.
And at that time, and then this has totally changed since then, but it opened with a description of the disorder. And it was alpha-1 antitrypsin deficiency, comma, usually fatal, comma. Well, that's as far as I read. I just was like, what? She didn't tell me that part.
Right.
You know?
You're like, fatal.
Yeah. That was
Which,
difficult.
of course, we're talking a long time ago. Things have dramatically changed.
Yes.
And we have great therapies and offer great hope and long-lasting improved life for our patients.
Yes.
But at this point, you're faced with what you think is a fatal diagnosis. You started off as asthma, identified as alpha-1 antitrypsin deficiency, declining lung function, and here you are now told fatal. At this point, you kind of are living this young, healthy life. You thought you're in your 30s, and now all of a sudden you kind of hit rock bottom, did you go through some, emotional distress to say, how am I going to get through this? And
Traumatic life changes. Starting with recognizing that I was losing lung function and that the safest place for me was going to be home.
Right.
Made a decision with my pulmonologist that it was time for me to go on disability. So I had to lose my job. Went through a divorce. Pretty much lost everything.
Right.
And was living a very, very different life from the one that I had prior to all this. And especially very different from the plans that I had for myself. And worst of all, it interrupted my life.
Right.
From my prime earning years, from about mid-30s to mid-40s. I wasn't able to make any money.
You couldn't do anything.
It was.
You couldn't breathe.
Yeah.
How did you pull yourself up from the bootstraps? How did you rise
Two things.
to really a true hero in my eyes?
Two things. The first was I started volunteering. And I think one of my biggest issues was that I was not doing anything. And because of that, I was in a depression.
Right.
And I had no reason to get up in the morning, and I had no reason to get dressed, so I didn't. And that is no way to go through life.
Mm-hmm.
And so it wasn't just me. This was with some help as well, with some people who were making suggestions. And one of the things was, if you thought about volunteering, because they're not going to take away your Social Security disability income for doing something for free.
Right. At this point, financially, that's a really real
it's
concern.
a very
Many of my patients are very concerned.
So I started volunteering within the Alpha-1 community, and eventually became the support group leader for the state of Georgia, which was very, very important for me. And then I volunteered in my local community with the Arts Council and the Children's Nature Science Center.
This is your all of a sudden you have a call to action, and you're like, I'm going to be a patient advocate and start volunteering for Alpha-1, and maybe I might have a fatal condition, may not be here for long, but I'm going to try to help some other people. Yeah. Not realizing at this point that your story, we're only a quarter away, right, through your story.
Yeah, I didn't recognize the eventual immensity of what that ended up.
Right.
What came from starting with that volunteering, where that ended up.
So you're doing this, you're learning a lot, you're exposing yourself, opening up to a lot of people.
Right.
You find that you enjoy this.
So even like I said, in my local community, everybody in my hometown eventually knew, this is what he's got.
Right.
And they had an understanding of the disorder itself. That helped a lot. But I think more importantly, it gave me, a reason to get up and a reason to get dressed. And I think one of the most important things that I was missing in my life was a purpose in my life.
Right.
And so this was that purpose, the volunteering, which was never something that I ever thought I was going to do. I mean, never, as a professional, it never crossed my mind that I should or could.
Right.
And it changed my life. It saved my life. And then something else happened.
Yeah.
And it had to do with a recognition of the condition that I was in, of recognizing what that really meant and what it didn't really mean. And I had always been told I had 38% of my lung function left, or 28% of my lung function left, or 25% of my lung function left. And we're watching it decline. And I came to the recognition that that's not true. Whatever lung function I've got at any single moment is 100% of the lung function that I've got.
Yes.
Now, it may not be very good, but in my case, it's never going to get better. And we're watching as it gets worse. So this is as good as it gets.
Do 100% with what you got right now.
And so that was when I got very serious with my exercise. And I was already on supplemental oxygen, had been for several years. And I went to the gym, and I started seriously exercising, taking care of myself. I had my O2 with me. I had my pulse oximeter with me. I was, tighter my speed and my O2 flow back and forth, and got very serious with treadmill work and lifting weights to the degree that I was able to.
Right.
I had developed a bit of a mantra for myself, which was to reevaluate myself on a routine basis, make sure that I'm staying on the right path, and then rehabilitate myself to the best of my abilities, understanding those abilities are going to change over time, and then never stop. So just those three simple things can change your life. So it wasn't pulmonary rehab; it was a gym.
But you were essentially probably doing better than pulmonary rehab of what you were doing, to be honest with you.
I did have a funny conversation once with my pulmonologist, and I asked him, I said, did you ever consider putting me in pulmonary rehab? And he went, no. I said, why? And I was a little upset. I said, what? What are you talking about? And he says, well, because you're doing more than they would do with you. And honestly, you're probably doing things they wouldn't let you do, but I trust you. You know how your body is working, and you've got the equipment to take care of it. And I was like, oh, okay.
So now at this point, you're basically excessively exercising better than any pulmonary rehab program would probably give you. You hit a lung function probably where you couldn't even exercise maybe anymore, or you start to see a decline. You're tracking it. How did you get the evaluation process or into the lung transplant process? And tell me a little bit about the call you get that triggers, we're going to get some new lungs here.
So let's start at the beginning of that conversation, which would be the really horrible exacerbation that I had, the one that just knocked me out and left me bedbound. And my pulmonologist wanted to admit me to the hospital. It was like every day he was calling. He goes, let me admit you. And I'm like, nope. The hospital is where people go to die.
Right.
And I'm afraid that if I go into the hospital, I'm not going to get out of the hospital.
You're going to live 100% with what you got. And you don't want to go.
And my 100% is not very good right now.
Right.
I can't breathe. And this is when the high doses of steroids really started. It was, and it had happened a number of times already, but this was
many episodes of steroids.
Really, yes.
And we know some of the side effects of steroids besides cataracts and glaucoma and elevated blood sugars. One of the processes is also bone demineralization, or you lose the strength of your bones. And then also steroids have an effect, which becomes important later in your story here, of decreasing blood flow to certain very important joints. And avascular necrosis, we call that. Yeah.
So it was after I'd gotten well from that. I mean, from being that ill, and had gotten over that, had recovered as much as I was going to. I had a different plateau. It wasn't as high as it had been. I lost some permanent lung function. And I'm back to the gym, and I'm exercising, and this is when I had the first monkey wrench really thrown in. I mean, I guess it's not really the first monkey wrench, is it? I started having pain in my lower back that got worse and worse, and then it migrated around to where I couldn't localize it, didn't know where it hurt. I just knew that it hurt, and it hurt more.
Right.
And my legs started getting weak, and I went to go see a physician about it, and was originally told I had sciatica. Which I didn't, but it led to a series of meetings with different doctors and different tests and different misdiagnoses. And it was a radiologist who came up with the correct diagnosis. And he said that what I have is prednisone-induced bilateral avascular necrosis of the femoral heads.
Yeah, your hip bones.
My hip.
And they were dying.
Yeah, so the blood supply had been cut off
Right.
to my hip bones, both of them.
Avascular
Bilateral.
necrosis of the hip.
Yeah.
And it's a serious complication, a side effect of high-dose prolonged steroid use.
Yeah.
And it's a risk you sometimes take when you're trying to preserve lung function.
Ridiculously painful.
Yeah.
Just ridiculously. Because you're experiencing both the death of the bone and the fact that the padding between the bones, well, the working surfaces, is disappearing.
Right.
And so you're getting what's left of the nerves.
Just rubbing.
Oh, it's horrible. Yeah. Just horrible. You walk like a crab.
So now you're in this lung transplant role, getting evaluated, and you have to have your hips replaced.
Right.
And from the steroid side effects. And there's a debate between your lung transplant team, who wants to give you new lungs, but you need a new hip, and they don't think you might be able to survive a hip surgery. They're debating which surgery to do first, and ultimately you wind up getting a hip surgery first.
So what was happening was that of course, the orthopedic surgeons who were going to be doing the hip surgeries didn't want to do this because they'd have to put me under, and they were afraid to, I was probably had about 20% of my lung function left at that point.
Right.
And they were like, no, you have to do the transplant first. And the transplant team says, if he can't rehabilitate post-transplant, we're not going to do the transplant.
Right.
So figure it out. And what they ended up doing was a spinal on me and Versed.
Yes.
Yeah.
Conscious sedation.
It's conscious sedation.
And block the nerves down below and do
Yes.
it while you're awake.
Yeah. Well, I mean,
conscious sedation,
yes,
right?
yes, yes.
But-
And I was so bruised and beaten up on the right-hand side because they had to try out the right size. It was
Right.
It's kind of an orthopedic
It's
carpentry.
a tough surgery.
3 months later, we did the other side, and that time was much cleaner. But I also woke up twice, wide awake. Still remember the conversations with the anesthesiologist.
Wow.
Are they doing such and such right now? And he goes, yes, they are. I'm going to put you back down now, okay?
Yeah. Amazing.
So,
That's incredible.
But this, unfortunately, was one step down from where I had been, because I had been exercising 5 to 7 days a week. And when my back started hurting, which ended up actually being my hips,
Right.
I had to stop walking on the treadmill and stop doing the exercise that I was doing for a long period of time. And then I had the hip replacements, and by the time I got back to the gym, I realized that I had lost all that muscle mass.
Right.
That I was keeping on by going 5 to 7 days a week, a lot of lung function.
And now the lung transplant team saying, hey, you need to be in better shape, or you need to get rehabilitated back to where you were before all this happened, because otherwise we won't be able to give you, list you on the transplant.
Yes.
You're now faced with this, and then how did you get the call, or what happened?
So leading up to that was from that, I guess, 2000 to 2002. It was about a 2-year period of probably the worst point in my life, I think, of not knowing if I was ever going to get a telephone call to get a transplant.
You're carrying a pager around?
No.
You had-
Everybody, we had cell phones
Yeah,
by
cell
then.
phones
We had
now, right?
high-tech
Okay.
stuff.
Yeah.
Yes. It was not an
A
iPhone,
flip phone.
but it was a flip phone.
Yeah.
It was a flip phone of some sort. And so I said, "You're going to give me a page?" And they go, "You got a cell phone?" I went, "Yeah." And he goes, "So?" I'm like, "Oh, okay, yeah, that makes sense."
What center were you at?
At this point, I was at the University of Virginia.
University of Virginia. Okay.
And
Were you living up there, or were you still living?
no, I was still living in Georgia, just
Okay.
outside of Atlanta,
And you had a good cell phone signal.
and had a good cell phone signal. It was an interesting time in my life. It was not a fun time in my life.
Of course.
But that whole, I'm dropping from 20% lung function down to 19 to 18 to somewhere between 15 and 18%.
So tell me where you were when you got the call, and what went through your head the moment you hung up the phone.
It was Memorial Day weekend. It was on Sunday, Memorial Day weekend. And I got a phone call, and they said, this is a transplant coordinator with the University of Virginia, and we're calling to tell you that we have lungs for you, and we want to make sure you're ready to come in and get your lung transplant.
Memorial 2002?
2002.
2002.
Yeah. And my response was, hold on. Do you understand? I've been waiting for 5 years for this telephone call, and I was hoping I was going to get it someday, But what I did not know was that it was going to be today. So can you give me some time? And I was like really adamant. I need some time. And her response was, you sound upset. Calm down. Everything is fine. You take your time. I'll hold.
I like the "I'll hold" part.
I
Now,
don't think she understood what I meant.
transplant coordinators are wonderful people because they get it, and they really make up the success of a program or not. And I
totally
know
agree.
exactly.
Totally agree.
And I know exactly what she was doing with you. Is I'll hold. And then so what did you go
without having to say no? You don't have any time.
Right.
It was just very pleasant.
Right. How'd she talk you into it?
Well, she didn't.
Understanding.
No, I was just had to make up my own mind. And
Right.
what I wanted to do was call everybody I know
Mm-hmm.
and say, this is the deal. They're offering lungs to me, but there's like a 10 to 15% chance I'll never see you again. Will you help me understand what it is that I should do?
Right.
And I couldn't.
Yeah.
And I had to make up my own mind. And immediately, you have
Where
this-
were you?
I was at home.
You're at home.
I was at home by myself.
by yourself.
And too many thoughts going through my head.
Now you have your family at this point. Your wife.
Right. I had my
first
mother and
wife,
father. That's
and
what I. And we,
no
my
kids.
mother and father had my entire hometown.
Right.
That was
Support.
a big,
Right.
gigantic part of my
course.
support system.
Huge.
All the volunteer work that I had been doing had kept me so active and social that
And
I was never going to go
a
without.
good transplant coordinator, and through the process, you know in your head that this is not just getting a new set of lungs; it's exchanging one set of disease problems for a whole nother set of issues that you're going to have to deal with
Right.
with a successful lung transplant. Knowing that, as I tell many patients, and the odds have certainly improved, and technology is better, but out of every 10 patients we transplant, about 50% of them in the first year don't make it. And then out of the 50% that remain, next 5 years, 10 to 20% may not make 5 years survival. And so, that's a tremendous burden of decision. And it's your decision, like you said, you need to make that decision for yourself. But I'll wait I'm going to put you on hold because we need that decision now.
Yeah. And my thought process that made it simpler for me was to recognize that I haven't smiled in over 6 months because I've just run out of things to smile about. My quality of life was so low that it didn't really matter to me. I was at what is it that they say? They call it try or die.
Yeah.
Said, you're not going to make it much longer, and you're not enjoying this.
And you realize you got that call, and you were smiling.
It's time.
So you get.
They had made arrangements for a Learjet air ambulance to fly me from Gainesville, Georgia, to Charlottesville, Virginia. It's about 500 miles. Takes about an hour. No time at all. They had, prepped me for surgery. I was all shaved down and painted kind of orange and really odd. It was a very relaxing experience for me, actually, because I had done everything that I could for so many years, everything that all my medical professionals could do for me.
Right.
But we were at a dead end, and it was like it was a lot of anxiety at first, and then when you're just kind of a release of.
And now's the time, and that's always tends to be the case. You kind of get to the point where we know you're ready for lungs, and we're looking for lungs. And there's a small window of opportunity where you're too healthy. You're too healthy to get the.
You're healthy enough.
You're healthy enough that you don't need the lungs, but you're not really sick enough yet either. But then sometimes you can get too sick, and you don't qualify for lungs.
Fall the other side.
In that small window, and when you get that call, it's really important. And I want to talk more about those lungs at the very end here. But we know you're here today, and it's a success story. Tell me quickly how you handled that success. You get out of the hospital, you have a new set of lungs. What did you go do?
What I wanted to do was to take advantage of the years of exercise that I had been doing to the degree that I could do it, But now I've got lungs that I can breathe with, so I can do that same thing, but go so far beyond that.
Because you're breathing great now.
I had incredible.
You're getting your muscle mass back. You're doing
well. What I wanted to do was run,
right,
because I wanted to really make myself short of breath, and then recover from that and do it over and over again, and just get better and better.
Right.
And because of the artificial hips, I couldn't run.
Right.
And I couldn't walk fast enough to make myself short of breath. I couldn't
so
raise
you
my own heart
decide
rate.
to pick up.
It was the most stupid decision I've ever made in my entire life.
This is great.
I decided I will take up mountain biking.
Mountain biking with a brand new...
With two fake hips and a double lung transplant. What a great idea.
And not just kind of do it a little bit. You're all in on mountain biking.
Yeah.
And racing and trying to compete.
Well, I'm competing with a friend of mine who is a very active mountain biker.
Right.
It's really his fault. He's the one who talked me into getting a mountain bike to start with.
And what happened?
And about 3 months in, I wrecked my mountain bike, which we all knew was going to happen, right? I wrecked it very badly. It's called a Superman. Went over the handlebars, flying through the air, thinking to myself, "Don't land on your chest, because you're only barely
3 months out of this."
Yeah, so let's twist in the air, and I did, and I landed on my left side and proceeded to shatter my left femur.
A femur fracture, as we all many people may not know, serious fracture,
extremely serious,
painful, lose a lot of blood, can be a real medical emergency and require surgery and be disastrous.
Yes,
in a
lot of different reasons.
In any normal, healthy, regular person,
right? And it took them about 5.5 hours to put my leg back together. I've got steel plates and a scar that's from my knee all the way up to my waist, and all these screws and wires and things like that. And but the important part was that the doctors had put me back together, and I'm in the hospital bed and thinking to myself, okay, I've got a broken leg, but I'm okay. The doctors have done their thing. They replaced the hips. They fixed me. They fixed my leg. They fixed me. I'll have to wait for my leg to repair, but I'll be able to get back to some kind of, really, really high intensity exercise life. And it just took a little bit longer than we had expected because of the detour that I took about 2.5 hours after the surgery when I threw a fat pulmonary embolism.
Yes. So a fat pulmonary embolism, essentially like a blood clot, but the bone marrow in your femur, one of the largest bones in your body, has a lot of fat in it, and that fat bubble basically can travel up into your blood vessels that supply the oxygen to the lungs, and allow you to pick up oxygen from the lungs. Of course, the anatomy of the lungs are a fascinating thing to me. That's why I'm the lung doc.
Right.
Has a dual supply of blood, but when you get a lung transplant, one of those supplies go away. And so it's very important to protect the single supply that you now have. And getting a fat embolism, along with the inflammatory and the immune system response that triggers with that, is also blocks the flow of blood to the lungs.
So I quit breathing.
And so you have a transplant, and you quit breathing, and you're on a ventilator at some point.
Yes, and they induced a coma, and almost immediately made plans to airlift me by Learjet air ambulance all over again back to the University of Virginia. Yeah. And no one was able to wean me off of the ventilator. They couldn't get me to breathe on my own.
Right.
So I was in and out of this induced coma.
And we're making attempts to try to get you off the vent, and it's not working.
Right. I'm suffocating over and over again. And 3 weeks after my bike wreck, the sirens went off in my room in MICU, medical ICU, and they came in and found me still unconscious from the induced coma, but I had extubated myself and taken everything out of my throat, and I was breathing on my own. And
amazing,
a miracle, ridiculous.
Right.
It's not supposed to happen.
It wasn't your time.
And they sent me home 4 days later.
Yeah, just rapid turnaround.
And it's like, because they didn't want me to die in their hospital. That's why. It was like, good, you're fixed. Get out of here.
So you have a set of lungs. You go through another episode where you almost lose those set of lungs. You survive, and there's a higher calling. Obviously, there's something for you left to do, and I want to talk about, you decide, you're going to do something now, and advocate and live beyond your wildest dreams, as you say, and I kind of want to talk about this legacy that you have. And talk about your lungs and you, because you have two legacies, really. I want to share with you a picture I have that I find very inspiring, and maybe we can show this to the audience. But this picture I have of you, and maybe you can comment about who this person is in this picture, what you were doing here. And I try to sometimes give that to my patients who are going through struggles with their alpha-1 disease and being considered a transplant, because you're smiling, but you also are really introspective there in that profile picture of you. So tell me about that, your lungs, and who the person is, and what you do.
So about a year and a half after my lung transplant, I started a conversation with my donor's family, with the family of the person who had donated lungs. Didn't know anything about them. And eventually found out that my donor was a 14-and-a-half-year-old girl. She saved 5 people's lives. With solid organ transplant. And I met her family. I guess I wrote a letter to them a year after the transplant. And it was about a year and a half after that we met for the first time.
And they were receptive to your outreach?
Very much. Very much. They were actually broached the subject of, I didn't want to yet, but they were saying, we'd really like to meet if you are interested in that.
Right.
And I'd been afraid to start that conversation.
And arranged also through the transplant coordinator?
Yes. It was arranged. Well, yes.
Again,
got the whole thing all set up. Back at the University of Virginia, I was going up for a checkup. They were from Lynchburg, Virginia, and they just drove up to Charlottesville. And we met and spent 2 hours together the first time we met.
And just like your life wasn't over yet, you had something left to do. Her life isn't over yet either.
Right.
There's 2 legacies. So, and that you have family now, and if I can share, one of your daughters is.
I have one child.
One child carries your donor's name, correct?
Yes.
And out of respect, and now you run. And this picture is you did a marathon or a running event at some point.
Once I recovered from the broken leg and rehabbed for 10 months from the fat embolism. I'd lost 40 pounds in the hospital, so it took a long time. So it took 10 months to rehab from that. I started doing triathlons, and right in the middle of all that, met my donor's family, and found out that my donor's father was a runner in Virginia, and somebody said, y'all should do an athletic event together. You could raise awareness for organ donation and for alpha-1 lung disease. 5 weeks after we met, we did our first race. And that was an 8K race. It was at 5 miles. Of course, I still can't run. I'm doing this, I'm doing an ugly,
because of the
horrible,
hips and the
because
leg
of the hips. I'm doing this horrible racy walky thing. I'm breathing just fine. And he jogged next to me, and that was, I think, the beginning for me to recognize what this meant.
Yeah.
Because when we crossed the finish line, the local TV station and newspaper did pieces, but then people started coming up to us, and they would say things like, I read that article, and I know who you are, and I want you to know that because of that, I've decided to become an organ donor.
Yes.
Or tell me more about alpha-1, because I've got a cousin who needs to be screened.
Cathartic experience for you to realize that
this was a gift that we've been given.
Yes.
This ability to have a positive impact.
Right.
And so over the next year, Kevin and I did several more races. His donor's father's name was Kevin.
Yes.
And wonderful, wonderful man. And we started doing other races. We did a half marathon in Nashville, as a matter of fact.
Yeah.
And then a year after we met, we went back to Richmond and did our full marathon together.
Full marathon.
And the next morning we were
I
on,
can't even do a full marathon. That's amazing.
we were on CNN the next morning.
Yes.
So this is when it began. This, been given an opportunity to have a positive impact, and now you've been given a platform.
Right. You have the gift, a positive message, and there you have a platform to.
So it wasn't just CNN. It went on and on.
Right.
There's a lot of publicity from there to Sports Illustrated to HBO to ABC World News.
So you and her,
Yes.
and the lungs, have had a dramatic impact, not just in a small little community from where you were, your town and support, and hers up in Lynchburg, but now, not really even nationwide. I mean, internationally, internationally, platform for the alpha community and organ donation, and how important it is for you. The whole story is just unbelievable, and how important it is that you have many lives and many gifts given to you, really, to continue on and do good.
Yeah.
And live beyond your wildest dreams. And
so this is the beyond your wildest dreams. This is where this comes from. Before my transplant, when I thought about what is it that I want to get out of the transplant, I said, bare bones, what I want is to be better. Now, I have no idea what better means.
Right.
Just better. And every now and then, I would allow myself to have this wild dream. And the wildest dream was that, what if I actually got back to normal? What if I had 100% of my lung function?
Yes.
And I would say, no, don't even think about that. And instead of getting 100% of my lung function, I ended up with like 135, 140% of my lung function, which is beyond my wildest dream.
And most physicians would go, this is totally unusual.
It's
and should not happen.
Right.
130%. It's just a powerful message. So now you're living those dreams, and you're advocating for the alpha community.
Right.
And as I tell patients, and you're so much a better messenger than I am, that there is always hope, and there's always challenges you're going to face, but nothing that can't be overcome. Yeah. Len, I want to tell you, I'm so excited to have you here today, and this is so important for our small little town of Chattanooga, our small little practice. I have a lot of patients that are seeking help, seeking hope, and when they hear this message, it makes me want to work harder for them. But I also want everyone to know that we're not just working hard for you, but there's advocates like you out there, particularly in the alpha community, who is another voice they can go listen to or talk to, aside from their medical professionals, to give them more hope and encouragement. And I know we talked a while and we covered a lot of topics, but I just want to say thank you for being here, and I appreciate
Thank you so much for having me. It's been a real pleasure.
Everyone, go out there and do well, keep the faith and the hope, and breathe better again. Thank you.